how and what to say in this video, which some of the points might seem a little bit basic, and you may be wondering why you're covering this, but it's really important to understand and master these fundamentals. And remember that when you get into the interview, the nerves and the pressure of the situation, and maybe they ask a question that you haven't prepared for, all of these things are then going to factor in. And so as long as you have the basic underlying principles sort of deeply ingrained and you've practiced enough, then you should be able to deal with all of these unknowns. Generally, when thinking about conversational skills, we can look at the things you say and the things you do not say. In other words, what you actually verbally communicate, and then the non-verbal communication. So things you say, how you say it. So are you speaking really quickly? Are you speaking really slowly and showing that you're taking your time and thinking about it? The general tone, and you could also sort of put volume into this as well. So are you speaking sort of loudly and clearly? Are you sort of mumbling? All of these things are really important things to nail down. And then specifically what you actually say. So the language you use, are you using appropriate language? Is it formal enough? Is it too formal? How are you structuring your answers? So are you structuring them with a sort of clear thought process? Is it all a bit of a mess? These are all the really important things. That's sort of the meat of what you want to say. And then the things you do not say, so the non-verbal skills. And these are really important in terms of generally building a rapport with the interviewer, and also just getting your point across and being very clear about it. So presentation, so generally sort of how you're actually sort of presenting yourself in terms of how you dress and how you look and how you appear before them. And also things like hand gestures, and which I'm sort of doing now naturally, which help to sort of enforce points and just make it a little bit more engaging. Eye contact is really important. So maintaining eye contact, making sure that the examiner knows that you're sort of connecting with them, especially if it's something like a simulated patient encounter. It can be quite scary because there's a stranger and you have the pressure of the exam. So this would be in something like an MMI station. You may have a patient, and you need to make sure that you maintain eye contact to build that relationship. And then active listening, so nodding along and using words to confirm that you've understood, and using their language and reflecting it back onto them, and sort of mentioning things that they said. All of those really important things to make a conversation a two-way thing, as opposed to it just being you sort of speaking or just being them speaking and you listening. So this is kind of the summary of communication. And if you can master all of these skills, then you'll do really well in terms of actually communicating and building up that relationship with your interviewer.